few organizations have vowed to challenge the implementation of the National Health Insurance Bill. This comes after the National Assembly passed the NHI Bill with 205 members of Parliament in support of it. The bill makes provision for one pool of healthcare funding for private and public healthcare providers. According to the Health Department, the aim of the bill is to provide equitable access to quality healthcare services. Perhaps to unpack the impact of NHI, we're joined via Zoom by Damian McHugh from Momentum Health Solutions. Damian, good afternoon. Thank you for your time with us here on the SABC.
Good afternoon, Lisa, and good afternoon to all your viewers.
So, the National Assembly having passed the NHI Bill, please break it down for us. Ultimately, what does it mean? What does NHI mean for me, perhaps for the youth at large?
At the moment, probably not a hang of a lot, Liesl. I think there's still quite a few steps that have to be taken before NHI or universal healthcare is rolled out for South Africa. So for now, we know that the bill has been signed off by Parliament, but actually it doesn't change anything for our youth today. It doesn't change anything for us today. I think it's still important for us, particularly the youth. Often not that I'm young anymore, but I think the youth often feel that they're bulletproof and they don't need to look after their healthcare because you're young and healthy. And that's often a mistake. I think so it is important still to take care of your healthcare, and if you can, join health insurance when you're younger. It's often cheaper. You often don't have underwriting issues. So still look after your healthcare. Private healthcare is often a good place, to begin, whether it's a medical scheme or health insurance, to ensure that if something drastic happens to you, that you're covered. We could still see national health or universal healthcare not being rolled out in South Africa for 5 or 6 or even 10 years, as the bill still goes through process. There are quite a lot of organizations who are quite concerned about the bill, so there may be even some legal challenges to what's been proposed. So it's important for our youth, particularly today, as we're focusing on the youth, to take care of their healthcare and their health insurance before the national health insurance is rolled out for all of us as South Africans.
As we look at the developments and the aim to provide universal healthcare coverage as per the SD goals, the UN's SD goals, what would you say, in your opinion, is wrong with the current system?
I think, look, the current healthcare system in South Africa, but in the way in which the private and public healthcare system is set up, has big discrepancies in it, and hence why we need a system which provides better access for care for more South Africans. So the private healthcare system has probably more than half of the hospitals, close on half of the hospitals in it. It's got probably more than half of the doctors that are practicing in South Africa are probably practicing in the private healthcare system, more than half the nurses, and yet it's not covering more than half the people. Only 9 million odd people in South Africa are covered by private healthcare, and about 51 million are covered by public sector. So you can see the discrepancies that exist between the two. So we need a national healthcare system. I think perhaps the biggest challenge that we face in the bill in its current form is the sort of idea that we have to have a single fund or single payer system. And there's there's a lot of different types of national healthcare systems around the world. As Germany has as an example, it's a multi-funder system. So there's private companies or private insurers can still participate in a national healthcare system, delivering the same quality care for everybody, but the burden doesn't sit all on the state. The burden can actually be distributed accordingly. And we think that system probably has better chance of success, particularly in the initial rollout. You use some of the private sector capability, experience, the ability to pay claims, the ability to assess claims, the ability to watch fraudulent claims. You don't need fraudulent, activities in a public healthcare system because this costs the taxpayer and the country more money. So all of that expertise shouldn't be lost in our system. And we think that there's opportunity for a more staggered rollout where public and private are working much closer together and delivering a system which is perhaps just more easily implementable. I think one of the other challenges we face currently in South Africa is there's a, if I can call it, a bit of a lack of trust in sort of state-owned or state-focused initiatives like this one. And we really don't want it to start off badly. We really would love it to start off unbelievably well, and we build trust again back in our youth and also in our economy. So we can't afford health shedding. Load shedding is one thing. Health shedding is a totally different thing. So we really want to be able to to support a system that we believe is absolutely critical for the success of South Africa, but in a way that makes sense in its rollout, that it's implementable and it delivers the quality of care that we're looking for.
No, absolutely. I think also when we look at the role of medical schemes once NHI is implemented, what's been reflected on that front? How are they also going to be impacted? How does that affect the economy perhaps as well?
The way it's currently worded in the bill is that the medical schemes will not be able to offer what is called complementary cover. So in other words, if the National Health Services offer GP visits, medication, let's call it also physiotherapy and so on, the medical schemes will not be able to offer that level of cover. So you can't offer cover that's the same as what the National Health is offering. You can offer supplementary benefits. So it depends on what level of benefits are provided in the initial rollout. In some of our conversations with the Department of Health, they've indicated that they'll roll out primary healthcare first and secondary and tertiary care in the national healthcare system later. It will depend on that. So the medical schemes will be able to play a part, but not at the same level or the same level of care as the National Health Services, or what's been proposed. So what that does mean is, let's say, for example, the National Healthcare System provides GPs, medication, physiotherapy, all of that sort of first tier or primary healthcare. Medical schemes won't be able to cover that. And so there is potentially a threat to the way we understand the medical schemes and what they offer now. Obviously, premiums would then change. There's potential, obviously, for some, I wouldn't necessarily say loss of jobs, because jobs can be moved between, the national healthcare system as well as the private healthcare system. But what we mustn't lose is expertise, the expertise of claims administration, paying claims, the expertise of hospital administration, as an example, expertise of doctor administration. We don't want to lose excellence in our healthcare system.
Yes.
And I don't think that's government's intention. And we definitely don't want to lose funders and or providers of healthcare. The system is an ecosystem. Without doctors, without nurses, there's no healthcare system in South Africa either. So we shouldn't lose those services in this transition.
Damian, thank you for your time with us here on the SABC and for helping to unpack the implications thereof and perhaps where we are in its current form as in relation to the NHI Bill, of course, being passed by the National Assembly. Damian McHugh is from Momentum Health Solutions weighing in on that.